2, 1.
Nowadays, there's a new way to approach healthcare. It is an honor for me today to introduce my dear good friend, Dr. Yamani. Hey, Dr. Yamani, how are you?
I'm doing good, thank you. Thanks for having me on your show.
Thank you.
It's exciting.
Well, tell me, who is Dr. Yamani?
So, I started as a primary care doctor.
Mm-hmm.
Just went through training in internal medicine, and my original training was done at New York Medical College, Valhalla, Westchester County.
Mm-hmm.
And then I started my primary care practice right here in St. Pete's, St. Pete's, Florida. That was my first job. And then, so I started as a primary care physician. It was a private setting, primary care setting. And it was a routine protocol medicine that sometime I would see patients in the office, go to the hospital, nursing home, and most of the primary care practices would do that. But then after a few years doing that, I was increasingly realizing that it is not that fulfilling 100% demands of the patient. There was so many things that we were not addressing that. So so seeking other ways to address chronic disease issues, what I did, I went back to school, medical school, and I did fellowship training in nutrition and metabolism. And then 2 to 3 years of that programming, I trained under different doctors who were expert in nutrition and metabolism, and as a holistic approach to the medicine. But after that, I realized that there was not much structured around it. There was no model of practice that we can actually incorporate those more holistic approach where you actually address the issues that our patients have as a person, as a whole person. Most of our care is fragmented into different specialties and all that. So that, seeking that, I went again to Carnegie Mellon Medical School, where I did Masters in Medical Management. And there I wrote down this program that we have in our All Care Health Center in Seminole right now, where we have, what we did, we incorporated different aspect of lifestyle that is impacting chronic disease. So we incorporated, for example, how we eat, what we eat, for example, how much we move and exercise, and how much we know about stress management and all that, and how to do it on a community basis, right? So all these things incorporated together, we started practicing from that aspect. So I started as a primary care doctor. I did training in internal medicine, but then afterwards I did my graduation in nutrition and metabolism, and also management, how to actually, the delivery of the care is important. So